Hi, my name is Dr. Rajesh Shah, and today we are going to talk about how should the society behave with the patients who might be having vitiligo patches. Well, if you understand vitiligo, which is more of a social disease, as I always say, where patients are more concerned about vitiligo not because of the suffering they have due to vitiligo. In fact, vitiligo does not give any physical suffering, but the patients are largely concerned about how would the society react to them because of the patches of vitiligo or the white patches they might have on the skin. So the major concern or the anxiety the patients have is more of a social anxiety. They are always bothered about how would somebody look at the patches, how would the neighbors look at them, how would their colleagues in the office will look at, how would their classmates in the school or college or in the surrounding will look at the vitiligo patches, how will they behave. They are also concerned how would the co-passengers in the train or plane will look at them, having vitiligo. When they are traveling anywhere, they will say they are always conscious and they are very much concerned about how would other people, the strangers, as well as their own uh, known people in the society, in the social circle, in the surrounding, etc., look at that. They're extremely conscious about, this response to the society. Having said that, it is very important, and I would consider this as a social responsibility for the community, for the society, to react and to respond to the patients who have vitiligo. Since the patients of vitiligo are very sensitive to the comments and the faces made by people looking at the vitiligo, we need to be very much guarded and careful and sensitive as to how we should look at the patients who might have vitiligo patches. When somebody has vitiligo patches, as a person in the society, as an evolved citizen, we should behave very normally. We should not give any stare as if, oh, what is this? How did you get this? Where did you get it from? What are you getting treated this? I mean, how are you getting treated for this? And so on. Many people, especially in certain parts of India, they tend to be very vocal about expressing their thoughts about vitiligo, and they might even upfront say the same to the patient. Sometimes they make very negative comments about vitiligo. They might say, oh, okay, this is vitiligo, right? This doesn't get cured, or this is vitiligo because of, you know, they have their own social stigma attached to that. So these kind of comments, even when you make a small comment to the patients might take it very seriously. So the first and foremost thing is that when you come across somebody who might be having vitiligo, don't talk about vitiligo at all with the patient. Okay? And you don't talk about it, because your comment on vitiligo will make that person very conscious and more concerned, and might, the patient might feel hurt or a little humiliated or embarrassed about making any comment on vitiligo. So you learn to take it very easy. You may not make any comment at all. And you don't give even a stare, or don't look at it as if something strange has happened with the person. Okay, if you do that, that is the best way to react to the patient. If you have some little close relative or somebody who is known to you very closely, if has a vitiligo, say maybe your friend or your neighbor or one of your relatives, then after some time, if at all you want to talk about it, you may talk very casually. You might say, oh, it seems that you have some kind of a skin problem, and I hope you have gone to the doctor and getting it investigated or diagnosed. That's the way to put it. Okay, don't come out with throwing suggestions, and don't come out with giving suggestions uh, and your own opinions about vitiligo. That's the worst thing that possibly could happen, unless you are a doctor. So be extremely sensitive and careful about making comments, because your few words of careless comments could potentially damage the psychology or the self-esteem of the patient, who might be just a co-traveler, or who might be a distant relative, or who might be your colleague at work, or he might be your classmate or a family member. So next time when you see a patient having vitiligo or some patches, please behave differently. Please behave more responsible. Also, as an informed citizen, we should also know that vitiligo is not a contagious disease, in the sense that if you come across anybody having vitiligo, and even if you touch those parts where vitiligo spots are there, you are not going to get any infection out of that. You are not going to contract the disease, because vitiligo is not a disease caused by any infection or any virus or bacteria. So it is absolutely safe for anybody on this earth to touch the patient having vitiligo, to handshake a patient having vitiligo, to hug a patient having vitiligo, to kiss a patient having vitiligo. So next time onwards, let us be more sensitive about vitiligo patients. Thank you so much.